Hi, my name's Jessica Lawson.
I'm Andrew Byrne. And I'm Matthew Cobb. And today we will be giving a tutorial on how to test for blood pressure and heart rate at rest, as well as blood pressure and heart rate during exercise. So in this we will be testing for resting heart rate, and what you want to do is take your index finger and your middle finger and place it over the client's wrist, and you will feel around for a pulse. Once you get the pulse, you will hold it down for 15 seconds. And then when you get that number, you will then multiply that by 4, and that will be their resting heart rate.
For this scenario, we are going to be taking the resting blood pressure. For resting blood pressure, you want to place the cuff 1 inch above the crease of the elbow of the left arm. Place the stethoscope head flat over the brachial artery, and make sure that your client's arm is fully supported and slightly flexed. Quickly inflate the cuff to 200 millimeters of mercury. Once you're at 200 millimeters, release the pressure valve at a rate of 2 to 5 millimeters per second. The first sound you'll hear will be the systolic blood pressure. It'll be a clear, repetitive tapping sound. Once the sounds disappear, that is the diastolic blood pressure. Rapidly deflate the cuff to 0. You're now going to wait 1 minute till you take another reading. Always record your numbers in even numbers, and for a true sense of an individual's blood pressure, average at least 2 readings on 2 separate occasions. The 2 readings that you get should be within 5 millimeters, otherwise you need to take a third.
Now we will be demonstrating how to take blood pressure and heart rate during exercise by using the YMCA bike test. So he's on the bike, he has 0.5 resistance on, and he's cycling at a rate of 50 revolutions per minute. This is going to be the first workload for the stage, and this stage will last for 3 minutes. At 1:45, she will take his heart rate, and she can go ahead and do that now. And that is exactly the same way as if he was resting. Fingers right over the nerve, palpating, and you'll be doing that for 15 seconds, and then multiply that number by 4 to get beats per minute. And then immediately after, she will take his blood pressure the same way that was done by resting, having the elbow flexed, getting the cuff up to 200 millimeters of mercury, and then slowly releasing and listening for diastolic and systolic. And so this is important because this will help determine if the patient can continue testing or if they need to stop. In order for them to stop, they will need to get their systolic pressure up to 250 or their diastolic pressure up to 115. And then they will do this, she will take heart rate 1 more time at minute 2:45, and then they will then decide what is the appropriate workload for the next stage.
After you're gone, 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 I'll love you long after you're gone, gone, gone.